Now, how do I sign up for Medicare and when? I'm going to walk you through this step by step. Are you just getting started in researching Medicare and you need to know how to apply for Medicare, when you can apply for Medicare, or even how to delay your Medicare enrollment? This video covers all of that and includes changes in enrollment made during the pandemic as well as changes implemented in 2023. So stay with me. Hi, I'm Matthew Clausen with MedigapSeminars.org. We are an independent insurance broker helping people with their Medicare and retirement needs in 49 states from Hawaii to Virginia and Alaska down to the Florida Keys. We are a true independent insurance broker, and that means we work with all of the major insurance companies and offer all Medicare supplement plans. We also offer the prescription drug plans and Medicare Advantage plans from coast to coast. Most of all, we represent your best interest, not that of any insurance company, and our services are free to you, the consumer. Check out our 5-star ratings and then contact us. You'll be glad you did. So, question of the day: how do I sign up for Medicare and when? As soon as you turn 64 years of age, you should start researching Medicare. The first step is to learn how to apply for Medicare and when to sign up for Medicare. You'll also need to know whether you can qualify to sign up for Medicare online or are qualified to delay your Medicare without penalty. So let's start with the easy part first. There are two groups of people who will automatically be enrolled in Medicare. Everyone else will need to apply for Medicare coverage. The first group are those under 65 and on Social Security disability income. Your Medicare enrollment will be automatic on the 25th month of receiving that income. The second group includes those who are not disabled but decided to start taking their Social Security income early, before the age of 65. If you've been receiving your Social Security income for at least 4 months prior to the month that you turn 65, you too will be automatically enrolled in Medicare. In either case, you'll be provided with the option to opt out if you choose. There will be an opt-out card in your welcome packet from Medicare. Everyone else must physically enroll in Medicare to receive benefits. What I'm going to cover first is how and then when to enroll. Now, I've also created a clickable menu system in the video information box that's below, and I'm going to display it on one side or the other here on occasion, display the menu so that those watching on TV can see it and move backward and forwards as they choose. I'd like to watch my YouTube on TV, and there's no access to the information that we have down below. So let's start with what is Medicare. Of course, we cannot discuss how to sign up for Medicare without using some of Medicare's terminology. So let's start by briefly reviewing what you need to know about Medicare to answer the question, what is Medicare? When you apply for Medicare, you will receive a red, white, and blue card as proof of your enrollment. And no, my name's not John Doe. And this, though, shows your enrollment in both Medicare Part A and or Medicare Part B. And we'll cover Medicare Part A and B very shortly. One of the most confusing features of Medicare is the terminology. Medicare is made up of parts, and those parts are referred to by a letter. The Medicare Part A is inpatient coverage, Medicare Part B is outpatient services, and there's Medicare Part D for prescriptions. There's also a Medicare Part C, which is more commonly known as a Medicare Advantage plan. And that's a privatized replacement of Medicare Parts A and B. And that's important. Part C, Medicare Advantage plan, replaces Part A and B. And Part C, again, is known as a Medicare Advantage plan. So in this video, we will focus solely on applying for Medicare Part A and Part B, also known as Original Medicare. Your prescription drug coverage is separate, and I have details on your Part D prescription drug coverage at my website, partdshopper.com. Medicare Part A is your inpatient coverage. It is the part of Medicare that helps you pay for your care whenever you are an inpatient in a hospital or other medical facility. Now, I'm sure as you've worked over the years, you've noticed that Medicare payroll tax deduction on your paycheck. That tax deduction has paid for your Medicare Part A. If you or your spouse have worked for at least 40 quarters during your lifetime and paid that tax for those 40 quarters, you're eligible for Medicare Part A premium free. It's already paid for. Medicare Part B is your health insurance for outpatient and physician care. Any outpatient services and durable equipment are covered under Medicare Part B. Basically, if your health care is not covered under Part A, it should be covered under Part B. Keep in mind, Medicare's intent is to cover everything that is medically necessary, and they rely on your doctor to determine that need. Medicare Part B has a monthly premium. Now, most people will pay the standard monthly premium, which changes every year. It doesn't always increase. In fact, the Medicare premium decreased in 2012 and is expected to do so again in 2023. Higher income beneficiaries will pay an extra surcharge. Your Medicare Part B costs the government more than $600 per month. The higher your income, the closer you get to paying that full amount. Now, I have an entire video and blog on the Medicare surcharge called Income Related Monthly Adjustment Amount, or IRMA. And I've linked that video description here above my left shoulder, and there'll also be a link below. You can also find my detailed description of Medicare Part A and Part B there as well. I will leave you to explore that on your own in order to keep this video brief. When you're ready to enroll in Medicare, go to the Social Security website. Now, Medicare law is a subset of Social Security law. Keep in mind, you do not have to take Social Security income to get your Medicare. And what I'm about to go through is how to enroll in Medicare alone without enrolling in Social Security. Here's what's important about your enrollment period and the fact that Medicare Part A is already paid for. If you are eligible for Medicare Part A premium free, means you've paid for it from your payroll taxes, there's no penalty for late enrollment in Part A. Technically, there's no late enrollment in Part A, and I'll get more into that in a moment. Plus, you can enroll in Part A only, and if you qualify, delay Part B indefinitely. Generally, we encourage people to enroll in Medicare Part A even if you will delay enrolling in your Part B. Your Part A costs nothing, and it'll work with your other health insurance to increase your insurance coverage. We'll have more on that in a moment. Medicare Part B, however, does have a premium, and you can be penalized if you do not enroll when you're supposed to. Unless you're disabled under 65, the earliest your Medicare can start is the first day of the month that you turn 65. Medicare always and only starts on the first day of a month. The period of time that you need to enroll in your Medicare is called your Medicare Initial Enrollment Period. It's a 7-month window, includes your 65th birthday month, the 3 calendar months prior to your birthday month, and the 3 calendar months after your birthday month. 7 months in total. There is one exception to the rule. There's always an exception. If your birthday lands on the first day of a month, then your entire enrollment period is moved forward by 1 month. I have an enrollment calculator on my website that I will link here and down below. But let's do a quick example, an initial enrollment example. For example, if your birthday is April 20th, the first day your Medicare can start is April 1st. You can apply for Medicare as early as January 1st, 3 calendar months prior to the start of your Medicare. The last day you can apply for Medicare during your initial enrollment period is July 31st, the last day of the 3rd month after your birthday month. In this example, the person applying for Medicare prior to April 1 will have a Medicare start date of April 1. If the application was submitted in April, then Medicare will start May 1. If the application is submitted in May, it will start June 1, and so on. This is new as of 2023. If you saw a video or read an article that referenced a time penalty for enrolling after your birthday month during your initial enrollment period, that time period or that time penalty no longer exists as of 2023. So now, referring to that one exception, that if your birthday was April 1st, the first day of the month, instead of the 20th, then the entire process will move forward by 1 month. Your Medicare can start no earlier than March 1, and your initial enrollment period starts the prior December 1st and ends June 30th. Now, as you start this enrollment process, please keep in mind that it takes time for Medicare to get that red, white, and blue card out to you. In fact, it typically takes about 30 days after you apply to get your card in hand. If your Medicare starts before you receive a card, no worries. Your Medicare benefits exist whether you have that card or not. Everything will simply be rebilled once you receive your card and, of course, your Medicare number. So now for how to enroll in Medicare. To enroll in Medicare, you go to ssa.gov, stands for Social Security Administration.gov. So you want ssa.gov/Medicare. But before I walk you through this step by step, I would like to ask you a favor, please. Please press the like button below if you're watching this on YouTube. And please let me know in the comments if you find this information helpful and if you like the menu system. So when you like, comment, and share with this video, you're helping me and you're helping YouTube know that this video is worth watching. That way other people just like you who also have questions about the Medicare start dates will find this video. So let's take a look here at the ssa.gov/Medicare. It starts with a brief discussion on the parts of Medicare and an even more brief review of Medicare supplements and Advantage plans. This time penalty period will be gone, or should be gone, as of 2023, because that time penalty is gone. And what you're looking for is this bright blue button. Click this if you're enrolling in both Medicare Part A and Medicare Part B during your initial enrollment period. It's very simple as long as you already have a mysocialsecurity.gov access where you check your estimated Social Security income. You'll have to create a My Social Security account if you don't already. And again, this does not mean that you're signing up to receive Social Security checks. We're not doing that here. If you delayed enrolling in Medicare until after your initial enrollment, scroll down just a little bit more to already enrolled in Medicare. Now, follow these directions if you already have Medicare Part A or if you are applying for Part B because you're leaving employment, you're retiring, but you had delayed your Part B. These instructions are very straightforward. Form CMS 40B is your application. The Form L564 is for your employer to sign, attesting that you had creditable coverage. You fill out part of it and your employer fills out the rest. And of course, you wanted them to attest to having creditable coverage so that you are not subject to a late enrollment penalty. It then gives you the information that you need to deliver these forms to the Social Security office. So what if you can't get your employer to sign the Form L564? That is covered here as well. You simply have to go through some extra hoops to show that you had group health insurance. And by the way, if you are intending on delaying your Medicare because of employer coverage, you should receive from your employer a letter annually attesting to the fact that your employer coverage is creditable. Now, this would be for both Medicare Part D and Part B. You should keep a copy of these letters. It will help if there's any issues when applying for Medicare. So the question, will I be penalized for not signing up for Medicare at age 65. If you fail to enroll in Medicare Part B during your initial enrollment period and you do not have creditable coverage, you can expect to pay a 10% penalty for every 12 full months that you went without Part B. This penalty is to be paid actually with every Part B premium payment for the rest of your life. The 12-month countdown starts the day your Medicare would have started if you enrolled when you were supposed to. Creditable coverage is health insurance that Medicare deems to be generally equal to Medicare and equally to the benefits that you would have received with a Medicare Parts A and B. In fact, I have a cheat sheet. On what is or is not creditable coverage, and that's going to be linked below and possibly up there. And of course, it's on my website. So employer group health insurance is generally accepted as creditable coverage. There's some exceptions we'll cover in a second. If you or your spouse have employer group health care that you prefer over Medicare, you can then delay enrolling in Medicare without the risk of a penalty. You can delay Medicare indefinitely as long as you have creditable coverage. However, there are some important rules and some caveats that you must be aware of. First, creditable coverage can be either yours or your spouse's if you're participating in their insurance. Second, your group insurance must be from a group of at least 20 employees if you are 65 or older. If the company that you work for has fewer than 20 employees, Medicare does not consider it to be creditable, and you must enroll in both Medicare Part A and Part B. If you are under 65, it must be a group of at least 100 employees. Third, if you retire but your employer provides health care benefits after you stopped working, those benefits are not considered creditable. You have to be actively working. Fourth, COBRA. Currently, COBRA is not creditable coverage. That said, our industry associations are aggressively working to change that law so that COBRA becomes creditable. There's no reason for it not to be. But as of this video published date, it's not. Lastly, TRICARE. If you have TRICARE for life along with your Medicare Parts A and B, you're all set. I have a separate video that you must watch to avoid a serious mistake with your TRICARE, and that should be linked above and again below. So again, to ask the question, who can delay enrolling in their Medicare Part B? The answer is anyone who has creditable coverage through their own or their spouse's insurance policy. They can delay Medicare Part B indefinitely. So let's look at three other questions. If you delay Part B because you have employer coverage, when can you enroll in Part B? How do you do so, and do so that you're not penalized? If you lose your employer coverage, how long do you have to enroll in Part B before being penalized? And what about HSA accounts, health savings accounts? Why is your Part A start date important if you have an HSA account? Now, these are the questions that I will be answering here next, but first, please, if you haven't already, do press a like on this button. It helps spread this video out for others who are looking for answers on their Medicare. And if I miss something, ask a question below, and please let me know if you like the workings of the new menu system that allow you to shortcut right to the subjects you're most interested in. Thank you in advance for helping me. So here's the situation. You are over 65. You delayed your Medicare because you preferred your creditable employer coverage. How do you start Part B without being penalized? Easy. You can start your Part B any month you choose. You'll create your own special enrollment period by simply choosing which month to start your Medicare and submitting the application along with that form L564 that I mentioned earlier. Simply have your employer sign the form or follow the instructions online if you cannot get your employer to sign the form. That's it. It's that simple. So what if you lose your employer coverage or quit first without enrolling in Part B? When you are over 65 and you lose your creditable coverage, you have 8 months to enroll in Part B. The 8-month period begins the month after your creditable health plan ends. Warning, this is a big warning. The 8-month period refers to Medicare Part B outpatient services. You will have only 63 days to enroll in a new Part D prescription drug plan. 63 days from the end of that Part D coverage. I didn't design this system or all these enrollment periods. So don't shoot the messenger. What about Part A? If you started your Part A when you turned 65, then there's no big deal. But if you didn't, and you start your Part A, and it's after you're enrolling in your initial enrollment period. So after your initial enrollment period, Part A has a curveball. Your Medicare Part A start date will be 6 months retroactive to when you enroll in Part B. So if this is October and you want your Part B to start in November, your Part A will start last May 1, 6 months retroactive to your application. If you have an HSA account and you're contributing to your HSA account, the retroactive start date of Part A can get you into tax trouble. You cannot contribute to an HSA account when you have active Medicare. And that is why, if you are past your initial enrollment period, you need to stop contributing to your HSA 6 months before you'll start your Medicare full-time. I also have an HSA cheat sheet. Hand it over there. And that too is going to be linked below. It is also on my website. And that's going to help you determine, when do you stop your HSA contributions. So there you have it. That is what you need to know to sign up for Medicare. Now it's your turn. I make these videos for you to help you make an informed decision. Please leave me a comment below and let me know what part of this video that you found most informative. If you like this video, share it. I would love to see this shared on social media. And if you have a question that I did not answer, ask it below and I'll do my best to respond. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.